More than 39,000 veterans enrolled in the VA Tennessee Valley healthcare system will soon have a new place to get care. The system announced plans for its new Clarksville multi-specialty VA clinic. The 254,000 square foot space located off Bearbrook Place near Wilma Rudolph Boulevard will provide primary care, mental health care, and specialty services like cardiology and surgical procedures. It's set to open by 2030. It's part of a broader expansion that also includes 2 additional VA clinics, one in Nashville and one in Cookeville. More and more of us are turning to artificial intelligence for medical advice. A recent poll from the Kaiser Family Foundation reveals that about 1/3 of adults in the U.S. have used a chatbot to learn about their health. Well, our Nikki Hauser set out to learn whether there's merit in choosing a computer over a doctor.
Trading a doctor's office for a chatbot. It's not as taboo as it might have once been.
There are ways in which it's a benefit, and there's ways in which it might worry me.
I sat down with Dr. Colin Walsh, a primary care physician who also studies how technology interacts with health, to learn why a growing number of users are turning to AI for medical advice.
I think it's absolutely reasonable for people to want to reach out to get the best tools at their fingertips to learn more about their own health. But just to remember that those tools are very powerful, and sometimes they're powerful in ways that can be misleading.
Pooling decades of knowledge in seconds, Dr. Walsh says tools like ChatGPT can be a good starting point, with several caveats.
Pain is not...
Number 1, AI follows your lead. How you ask a question can lead to a specific kind of answer.
The way we ask it, and if we're excited about what it's saying and we're positive, if we're more negative about what it's saying, it's going to read that. And those answers were going to change.
AI can also oversimplify. While it makes its best guess, it doesn't have your medical history, and it can't assess your symptoms in person.
Think of these tools like a medical librarian that's read every medical textbook, but has never actually seen a patient. So why don't we ask it, I woke up feeling terrible.
We tried our hand at AI's medical advice together, first running the program through a common cold scenario and asking what to do. Turns out it's pretty good at identifying a virus like this one.
For the common cold, which is by its name common, this kind of common advice could be useful. So why don't we try changing the scenario, making it a little bit more serious?
When we asked about a more dangerous symptom, chest pain, Dr. Walsh says it succeeded in bringing up the most likely cases and advising the patient to then see a doctor.
It's acid reflux, like gastroesophageal reflux. It actually catches the barbecue detail that I put in there. Here's the honest bottom line. This isn't something to self-diagnose at home. Pretty good.
You're happy with that?
Pretty good.
Pretty good at giving base level advice, but without personal context or follow-up with a professional, it may not tell the whole story.
If these tools are leading someone to a diagnosis and that's it, they're satisfied, and they don't then reach out to verify that with a professional, that could put people at risk.
Bigger picture, AI can't replace a professional, especially when context is key or you need immediate help. Dr. Walsh says what it can be is a great learning tool.
So be willing to dig and think and ask questions and use it as an opportunity to really become more engaged in our own health.
Well, this is so interesting, Nikki. So what else did you learn by just sitting down with this doctor?
Well, he also included that any information that you input can then train other models. So with privacy concerns, just be careful of what kind of medical information you're putting in, because you don't know exactly where that data is going to end up.
All right, good advice. Thank you so much.